At the Society of Actuaries Research Institute, one of the key research topics we study is healthcare cost trends. And we've recently released updates to the healthcare cost model for 2022, which help examines the effect of COVID 19 and other healthcare trends. The model provides actuarial regulators and rate filing actuaries with insights on the effect of the pandemic on healthcare costs, and also from some of the shifting of costs due to the deferral and restarting of healthcare, and some changes that we've seen in behavioral health and substance abuse due to social isolation. This third edition of the model includes updates on COVID 19 hospitalization rates and insights on costs borne by insurers. There's also more details on claims for the summer of 2021, plus an epidemiological component that users can look to in order to investigate future pandemic scenarios. Achilles, let's drill a little bit further down into the data. What are some of the new data updates that this latest version of the model incorporates?
Thanks, Dale. The model includes several updates to data sources. First, we have updated deferral and mobility data from public sources. We also have updated commercial and Medicare data from our partner, Wakely. This data mainly consists of cost of COVID treatment, including medical claims, diagnostic and antibody testing, vaccination, and emerging long COVID claims. Experience now runs through July of 2021, which gives us a robust set of data.
And what are some of the new assumption changes that are now included in the updated healthcare cost model?
Thanks, Dale. The main assumption changes are related to COVID-19 costs data changes, as I mentioned earlier. In addition, the long COVID assumptions increased for less severe cases and decreased slightly for hospitalized cases. And we also now have separate assumptions for Medicare Advantage that didn't exist before. Finally, we updated our hospitalization assumptions and incorporated new dynamic factors into the model.
And Patrick, it's been great to walk through this new model and see all this coming through in the model spreadsheet. Can you go through some of the changes to the model itself that were made in this latest version, including what's going on with the hospitalization assumption?
Yeah, I'm happy to, Dale. As Achilles mentioned, we've updated the data that feeds into the model. But in addition, we've made some modifications to the model's interface to give users more flexibility with setting assumptions. The most important of those modifications is here, section 8 of the assumption page. These are hospitalization rates, and by hospitalization rate I mean the percentage of reported COVID cases that result in hospitalization. And in previous versions of the model, these assumptions were static across time. So a user had to enter one percentage, and the model used that percentage in every month of the projection. We've modified this section of the model, so as you can see, there are now separate assumptions for each month of the forecast. So this adds flexibility, and we've made a similar adjustment to input section 10. These are percentages that represent the portion of COVID-related costs that are borne by the insurer. And these costs in previous version of the model, they were static across time. You can now vary these percentages as you wish. Dale, that's sending it back to you.
Well, Achilles and Patrick, thanks very much for stopping by to discuss the new release of the 2022 Healthcare Cost Model Update. And if you have any feedback or questions about this particular report, please feel free to contact us at research@soa.org. The 2022 Healthcare Cost Model Update can be found on SOA.org by clicking on the Research Institute and then simply click on the Health section. You'll see it among all the other research reports that are there. Thanks for joining us today to learn more about all the projects from the Society of Actuaries Research Institute.